Youth vaping remains a serious public health threat with over 2.5 million teens using e-cigarettes, according to new CDC data funding from the potential Juul settlement could help address this epidemic. This segment sponsored by Truth Initiative. Joining us today to discuss these issues and more, we've got Robin Koval, CEO and president of Truth Initiative, and from Parents Against Vaping e-cigarettes co-founder Dorian Furman. Thank you both for joining me.
Thank you.
Yes, Robin, we'll start with you. How did we get to the point that we now have a national youth vaping epidemic, and why is it important that we address this public health crisis among our young people?
Well, sure. We didn't get here by accident, of course. This is all the result of clever marketing from the tobacco industry and misinformation. You know, Juul lit the spark, right, with a product that kids thought was cool, delivered very high levels of nicotine, could be stealthy, they could hide it, came in flavors like mango and creme brulee. And, you know, we know from Juul's own congressional testimony that they targeted these products directly to kids with social influencer campaigns and fancy launch parties, even attempting to infiltrate summer camps, if you can believe that. So kids were sitting ducks, and they had no idea, right? We did research that said 2/3 of kids didn't even know these products almost always contain nicotine. And now what's happened is, you know, Juul kind of lit the fire, but there are thousands of products that have come into the market afterwards, and they're all sort of playing catch me if you can with federal regulations and state regulations. And so today, we have 2.5 million kids vaping. That's a higher number than the year before, so not good. And what we also know, which is more disturbing, is this is not just recreational. 46% of high school kids who vape are doing it 20 or more days a month. We know from some other research that just came out that a lot of them are doing it within 5 minutes of waking up. So they're really addicted. And that is converging with another crisis. I'm sure you've heard about the youth mental health crisis, which is very serious. A lot of kids think that vaping is going to help them with their stress, their anxiety. That's misinformation that the tobacco industry has perpetrated over years, when in fact the absolute reverse is true. Vaping nicotine can amplify feelings of stress and anxiety.
Yeah. Robin, I want to visit with you for a moment. What does this Juul settlement mean for states, young people, and parents? What do we need to know?
Well, I want to really thank the attorneys general of all these states for going after Juul and holding them accountable for all the damage that they did. Now, the good part is when that's finally settled, there'll be money coming to all the states who are part of this settlement. And the states need to do the right thing with that money, right? They need to use it to reverse the damage that Juul created. So preventing kids from starting to vape, right? Denormalizing vaping in culture, and giving kids actual help to quit, normalizing that quitting is something you can do. There are tools to do it, and there's support for you to do it.
Yeah, for sure. Dorian, what do parents need to know? What should parents be asking of their states?
Well, parents should be asking for education. You know, parents have been blindsided just like kids were, just like schools were. You know, this came out of nowhere, really. So parents need to educate themselves. They need to understand what they're dealing with. They need to start talking with their kids from a very young age. You know, we recommend around 9 years old, because kids are being exposed to this out in the schoolyard and on the school bus, and they need to keep the conversation going. It can't be a one-time conversation. You know, they need to normalize talking to their kids about difficult topics. So keep it going and start early. And states really need to educate parents just as much as they need to educate teens, and work on prevention. You know, prevention and education are key, and support to quit is also incredibly important, because these kids can't do it alone. They need the support of a parent or a trusted adult to get through this. It's so addictive, and no amount of nicotine is safe for a developing adolescent brain.
Yeah, absolutely. We're going to have a link to some more information and help that Truth Initiatives provide to help those young people quit, like we've just talked about, and more information. You can find it all over on our website. Robin, Dorian, thank you so much for visiting with us today.
Yeah. Thank you.
Absolutely.